NABH means National Accreditation Board for Hospitals and Healthcare Providers. This body grants accreditation, and accreditation means it ensures the competency of a hospital in terms of infrastructure, manpower, processes, and finally the outcome. That means once the hospital is accredited, the patient can walk into the hospital with sense of confidence that I am going into a hospital who is following all protocol-based treatment, and it is ensuring that the hospital is infection-free, medication errors will be minimum, and on top of it, I must tell you that this hospital will be being efficient. Even the cost of treatment will come down in the accredited hospitals. See, in the accredited hospital, we send a team of doctors who are very, very experienced. They go and look into the hospitals, they look into the infrastructure, they look into how the nursing care is being done, how the medication is being prescribed, how the facilities are functioning. Only after their report is come to us, then another senior doctor review it, and then we grant the accreditation. Actually, so far out of 60 hospitals, 55 hospitals are private, only 5 hospitals are from the government sector. Because accreditation requires a lot of hard work. You will have to have updated infrastructure, and some of our government hospitals, many of the government hospitals, they lack in terms of infrastructure, facilities, and that's why to begin with, more and more private hospitals are coming up for accreditation. And they have written to all hospitals who are on the panel of CGHS, Central Government Health Scheme, that within 18 months, they must take accreditation, otherwise they will be removed from the panel. So this is an indirect drive to the hospitals to go for accreditation, number one. Many big corporate companies who use these hospitals for the treatment of their employees also are driving, they are telling them. Third is that insurance companies now are seriously thinking that they will impanel only those hospitals which have accreditation, because otherwise they are losing a lot of money if the hospital is not following the protocol-based treatment. So this also acting as a driver. And finally, I think the press and media, I think are a great promoter, that in the interest of patient, in the interest of citizens, more and more hospitals should go for accreditation so that patient safety can be ensured. You see, technology is developed so much now, but ultimately it is the physician and surgeon who makes use of this technology. So the physician and the surgeon now is getting a lot of help, but still the final decision, judgment is to be made by the doctor. And that is where the connectivity of the doctor with the nurses, doctor with the pathological lab, doctor with the paramedical staff, all those things we try to see in the standard. And only when the hospital is able to demonstrate that they have integrated manner of providing treatment in a holistic manner, we grant them accreditation. So far, 60 hospitals have been granted accreditation. More than 400 hospitals are in the pipeline.